AMCH, it's an NGO that addresses the unacceptably high mortality of mothers and their babies in Nigeria and beyond. We have the vision to reduce the maternal and neonatal mortality to levels that are significantly low enough, like the industrialized countries, and we want to ensure that these deaths do not take place anymore. AMCH is the acronym for our foundation's name, and it is ABIE Maternal and Child Health. AMCH was founded in the year 2013, but before then, AMCH was officially working without properly constituted as such. So we had taken some doctors to India to do some advanced newborn resuscitation course and observation on emergency care in the high intensive care for the newborn. So we can say that our history is actually before the 2013 registration that we have. It will be important for me to let you know that the 4 main objectives of AMCH is, 1, to train healthcare workers, particularly in the frontline healthcare workers in the communities, and then to also ensure that they are current in the evidence-based interventions that reduce both maternal and newborn deaths. We advocate for newborn health with the governments, both at the local and the national level. We also do public awareness using the WHO Health Days. We make the public to realize that, for instance, breastfeeding is important, the significance of breastfeeding, the significance of taking care of premature babies. So we have yearly organized activities to commemorate these WHO days. So we've done quite a number of trainings, sole trainings, as well as collaboration with other NGOs. We collaborated with the Akins, who had a grant from the Rotary International Club of California to do a training. So we trained in Ekpe, we trained healthcare workers in Ekpe and Ibejuleki under the sponsorship of Rotary Club of California that did this training. So we repeated what we had done in Ikorodu. Now it was a little broader because it was not just helping babies breathe. We did what we call the Essential Newborn Care course. So since then, we've been doing it almost on a yearly basis. We've been to other locations to do this training. We have done it in Ifakojaye, in Ojokoro. We have done it also in Alimosho. So AMCH has been training frontline healthcare workers on essential newborn care over the years.
So in front of grunting, you will see one color that says danger sign. You are going to circle that danger sign. So when I look at the form, I will know that that baby has grunting. Am I making sense? Now, as you progress, you will get to a particular, you see where you have to take temperature. You see where you have to check the color of the baby.
I attended the Helping Babies Breathe program in the year 2018.
I attended the training in May 2018.
I attended the training in year 2018.
I attended the training in October 2019.
It was an educative program.
The training was highly effective. The program was really inspiring, and I learned, I relearned, and I unlearned. I unlearned that you don't have to clean the baby's vernix caseosa. Immediately the baby is born, you don't have to clean it off. You have to leave it because it helps the baby to prevent infection and help the baby's skin well. So I learned that one.
Before the training, there are so many things we were doing wrongly. For instance, immediately we deliver a baby within 24 hours, we'll clean and we'll bath the baby. But part of the training says we should keep the baby warm for 24 hours. So we don't bathe the new babies again, and it is still part of what we are doing now. So it has changed our orientation, and it is what we are still practicing presently.
Before the training, what we are doing here is okay, and after the training, we imbibe the knowledge into our practice. When we deliver baby like that, if they couldn't breathe very well, we do assist them by rubbing their back, by tapping, by giving some medication that has been prescribed by the doctors, and it works effectively.
I was trained 2018, August precisely. Before the training, we just deliver baby to climb the cord. We won't even wait, we just climb some cord. But after the training, a lot of changes has occurred because we follow what we've been trained on. The rate at which the neonates dies after birth, it reduced so many.
Abbiamo culuso to ba deru siwa atun pomo sei e wa wo ya ton fomo loyo.
It was a practical training, and it has assisted me in neonatal resuscitation, helping babies breathe and prompt intervention.
So AMCH has been in the background in those training. So we first of all had a TOT, training of trainers, in which we trained 48 healthcare workers who now were facilitators to step down the training to the other healthcare workers, and some private hospitals also had the benefit of getting this training.
A lot of us underwent the training, so we did a step down training, and a lot of the changes that we were taught, the new things that we were taught, we introduced it to our colleagues too, and they embraced it. And I can say that impact has been positive even since that time till now.
Me and others that we attended, we did a step down training then, and because the thing is part of us now, it is part of what we give to the new ones too. So it is part of our normal day routine.
After the training, when we came back, we had a step down training. Initially, we had a step down training with the help of the MD, with the doctors first. Then since the training was attended by nurses and doctors, later we had a joint one with the doctors and the nurses. And with that, we were able to cascade the training to a lot of nurses and doctors, and they too, they had a step down during ward rounds, during deliveries, and we were able to carry a lot of people along.
Well, these trainings have helped to reduce neonatal deaths. Because being a pediatrician, our emphasis has been more on training for the newborn. And we have seen a death reduction of over 20% in the areas that we had trainings. Ekpe and Ibejuleki are hard-to-reach areas. And it was nice to be able to get there with this training. And we also had significant impact because the communities there were used to traditional birth attendants, even though the hospital CMD had been interacting with the TBAs.
Traditional birth attendants are also important because we cannot, in this our environment, community, we cannot rule them out. But also, if they can be trained separately, then it will be beneficial because we have a lot of infant mortality coming from traditional birth attendants, so they need the training.
Yes, the training will be a lot. It will be beneficial to the TBAs, traditional birth attendant, because we already told them to know their limits, but they still go about still doing what they are not supposed to do. So I think this training should extend to them to be able to resuscitate baby and let them know when to refer. So it was good to reach, the most needed indigents of Ekpe and Ibejuleki, since it was already established that they had some interactions with the TBAs, so they could use the skill not only in the hospital but also in the community. So the other thing is that we've taught them to do early and prompt referral of patients. So to be able to identify danger signs, and when these danger signs are identified, they now know, be selective in which babies are delivered in their facilities and help mothers to be referred promptly and early. So that has brought down the cases of perinatal asphyxia. It has brought down the newborn death rates that we have seen.
The training had effect because on mortality, because I work in the theater, and using that method, everything they taught us, it really helped it reduce it. Only few people had training on newborn helping babies breathe, but immediately after the training, there was changes. I will give it a 5 out of 5.
I will rate the training very high because it's very educative and also has some skill that we use in performing to help the baby breathe.
The impact is very, very effective, very good. The mortality rate reduced.
Yes, it has a very positive mortality effect on mortality rates.
It has impacted a lot because when this hospital was under Lagos State government, they were giving award. The Obs and Gynae team and the pediatric team were giving a lot of awards because they had low mortality rates.
I will give kudos to them. They tried and they are trying, and they should keep on trying.
For the organizers, I will tell them well done. They are doing a fantastic job. They should keep it up, and yes, there should be a periodic ongoing as in training. Periodic, it should not just be one-off. Number one. Then during the training, I would suggest that we have more on practical sections with mannequins. This will make the training to stick better.
Yeah, the final message that I have for the organizer of the LBB breed is they should retrain people like nurses, doctors, so that this skill will not be wasteful. And like quarterly, they can be coming and ask some question about the training or set up some questionnaires for the trainers.
Why the more training will be needed is like this institution, for instance, nurses are not placed only in one ward. You can work in neonatal units today and you are asked to go and work at general side. That is general. You can be in medical wards, surgery ward, auto wards. So if that person leaves that ward, we all shift, or the change just comes like January. So there is no always time for that other person that is taking over to learn. Though for like 5 or 6 years ago, we always make sure that out of 10, let's assume we have 10 nurses on a ward. If you are going to move, we move like 8. We'll leave 2 so that the 2 can at least step down some of the practices to the 8th one. But it has always been a tedious one.
The training should not be limited to few number of people. When the training, if you want to commence the training, you should go all out that, okay, in this institution, we want almost everybody, and try to make up. It will not be, the training may not be once, it may be maybe quarterly or something, but everybody, all health workers, people that are involved in the care of babies should have the training.
What I want from you people in the nearest future is, if you are going to retrain, they should get all the gadgets, everything that we are going to use. Everything should be at hand for us. It's not that we'll be running extra skater for it. They should provide everything for us to use.
Yeah, you will notice that I have been talking about collaborations, because it's quite heavy in terms of the resources that you require. Talking about financial resources, you require mannequins, you require training equipment, and then you require logistics to get to these people. We also require materials that you'll need to print to do the training, like wall charts, provider booklets, and so on. So not only that, the TOTs are done as trainings with accommodation for facilitators. So you have to put them in hotels, you have to rent halls, and it's not cheap. AMC want to take the training further into communities. We have not reached so many parts of Lagos State, and we intend to do so, and beyond Lagos State as well. But the constraint has been funding. Particularly the TOT is expensive, and then having people to now go into facilities to do this high frequency, training with which is shaped to meet their specific needs, would require more manpower, and also more monitoring and evaluation, follow-up, and training materials, because you will be doing so many at the same time. So we hope that we will find sponsors who will help push our work forward. We have collaborated with so many other people as an organization. We need to be able to stand and do this. Our collaborations have helped us, and sponsorship have come from kind-hearted Nigerians and organizations, but we need some more.